Labbe. I work at Greater Springfield Senior Services. I'm the supervisor to the Information Intake and Referral Department, Family Caregiver Support, and the Options Counseling Program. And I'm going to adjust my slide here. There we go. So our module's learning objectives are to share and identify some of your community agencies and discuss senior services. So who is Greater Springfield Senior Services? And I included our acronym there because we use those two so interchangeably with one another. So we are a private nonprofit organization, also known as an Aging Service Access Point, an ASAP, dedicated to maintaining the quality of life for our older adults, caregivers, and persons with disabilities. Our mission is achieved through the provision of programs and services which will foster one's independence, their dignity, safety, and peace of mind. Also to note that GSSSI is one of 25 different ASAPs that cover all cities and towns across the state of Massachusetts. So every city and town from Cape Cod to the Berkshires has an agency such as ours that is available and to be the gateway for folks to find community resources. On this slide, I'm showing our district or our catchment area. We have 12 cities and towns in our catchment area, besides Springfield being the most notable. As you can see, here's a short list for yourselves of the other cities and towns that we coordinate services for, and again, are the gateway for folks to find community resources in those locations. For our benefit, I wanted to share our two closest sister agencies in the local area. So West Mass Elder Care, their office is located in Holyoke. Their number is shown here for your convenience, and I also included on this slide the cities and towns that are in their district, along with our sister agency, Highland Valley Elder Services. Their office is located in Northampton. Again, the phone number for your convenience, and they have quite a long list of cities and towns in their district. The biggest notable reason for that would be because a lot of those smaller hill towns have smaller populations. Our programs. So this particular slide shows 16. We actually have more than 16 programs available to the community, but I wanted to just highlight the first 3 that are in blue on this slide for us. I'm going to do a little bit deeper dive quickly into Information Referral Department, State Home Care Program, and our Home Delivered Meals Program, Nutrition. So our State Home Care Program, this is the only program that is available to help non-Medicaid patients with ongoing in-home help that offers a subsidized co-payment for a month's worth of services. So co-payments are monthly, they're not weekly. That's something that we definitely highlight for our clients. The program also provides discounted in-home care services through a network of subcontracted agencies. The reduced fees or co-payments, if you will, for the home care services are based on an individual's or a couple's income. It does not look at their assets, which is something that comes up very frequently when we're meeting with older adults for the first time and discussing how much a month's worth of co-payment for services might be. It's actually based on their income and not their assets. Services that we provide include some case management. We coordinate the personal care, meal prep, laundry, light homemaking, and grocery shopping for the older adults. This program provides free ongoing case management, so a case manager that's assigned to a person's case follows them, and we touch base with them every 30, 60, 90 days and annually as well. But we always encourage them to call us at any time that there might be a change in status in their home. A person must be over the age of 60 to be eligible for the home care program, or they can be under 60 with a diagnosis of dementia or ADRD. And our essential services, these home care services to the community, have continued throughout the pandemic. I just wanted to highlight that, whether we have worked tirelessly to not have a drop in service. Our nutrition program, our home delivered meals program, also affectionately known as Meals on Wheels. We have traditional meals, medically tailored meals based on perhaps chronic illness such as diabetes. We have Latino meals and pureed meals. Our congregate meal sites are found at senior centers pre-COVID, but due to the pandemic, they're currently closed. So we've pivoted and we've increased our availability of the grab-and-go meals for more active or independent older adults who can drive to the locations. We've had multiple locations we've been adding throughout the last several months. Those grab-and-go meals are available for folks. Individual nutritional counseling is available. We have a registered dietitian that's on staff, and so if we encounter somebody who is going through, let's say, cancer treatment, we know that cancer treatment can really present barriers for folks with their taste or their dietary restrictions. So we have a registered dietitian that's available, and it's part of our services. There's no charge for that. We also offer evidence-based programs. Healthy eating is one of the ones I want to highlight for today's slide on nutrition. So again, normally this would have been done in group, but due to COVID restrictions, we're offering this in a virtual platform at this time. And then information referral department, near and dear to my heart as its supervisor. I wanted to highlight for you the multiple ways that you can reach us. Again, we're the gateway to the community to find resources, but really the information referral department is the art, science, and practice of bringing people and services together. So when individuals and families and communities don't know where to turn, the information referral department is here for them. So we're available Monday through Friday, 8 to 5, with our phone number listed. We also have bilingual intake specialists that are available, and they're bilingual in Spanish. We also, due to the pandemic, we, much like yourselves, pivoting to find ways to reach our community, we've added a chat function on our website. So www.gssi.org, that's shown here. We have a little bubble that'll pop up in the bottom right-hand corner, and you're welcome to connect with us anytime, send us a message. And it does store the messages over the weekend so that we can get to them on Mondays. And then we welcome professional referrals online 24/7 at our website, again, that www.gssi.org. And I thank you so much. My contact information is here. If you have any questions and need help, please reach out to me. Thank you.
We can, you're good.
Okay, great. So my name is Megan Lemay. I'm the regional manager at the Alzheimer's Association here in Western Mass. So I'm located in Springfield, but I cover all of Western Mass, all 4 counties out here. Nice to be with you all today. I'm going to talk about some of our resources here at the Alzheimer's Association. So our vision is a world without Alzheimer's, and a big part of our mission at the Alzheimer's Association is to actually end Alzheimer's disease and all other dementia by accelerating global research, driving risk reduction and early detection, and maximizing quality care and support. So these are our goals here at the Alzheimer's Association. A major part of what we want to do is provide care and support, or at least enhance care and support for those currently living with Alzheimer's or any type of dementia. It's not just Alzheimer's disease, but all different forms of dementia that we want to serve, and then the families that are impacted. And then also increasing concern and awareness, meaning educating the general public about Alzheimer's and dementia as well, and trying to raise awareness generally. Another one of our goals is to strengthen diversity and inclusion. We know that African Americans are about twice as likely to develop Alzheimer's disease than the white population in the United States. And so that's something that's obviously a huge health disparity based on race, and it's something that we are looking to address, doing research in, and making sure to do outreach and provide support and education to communities of color to make sure they're not getting left out and to reach out to them specifically. We are also the largest nonprofit funder of research into Alzheimer's and dementia. So a large part of what we do is funding that research to really try and make sure we're getting to a treatment, prevention, or cure of Alzheimer's disease at some point. We also have work on public policy. So we were heavily involved in getting the law passed in Massachusetts 2 years ago that mandated hospitals put in place a plan for better caring for those who come into the hospital presenting with a dementia, and also making sure that physicians and nurses receive more education specifically around dementia and Alzheimer's disease. So some of our services that are just really helpful to know about are our 24/7 helpline. So anyone is welcome to call our 24/7 helpline. It's staffed by clinicians 24 hours a day, 7 days a week. And so professionals are also welcome to call. If you have a question about the research or about anything related to Alzheimer's or dementia or services or resources, professionals are also welcome to call our helpline, as well as families, caregivers, care partners, or people concerned about their own memory. And this can be a first step for people thinking about their own memory issues as well. And we provide that helpline in lots of different languages as well, of course. We have a staff member in Springfield that's bilingual and speaks Spanish to provide care consultations and support to families, specifically in Western Mass, who are Spanish speaking. Okay. We also provide and organize lots of support groups in Western Mass for caregivers and for those living with Alzheimer's. So right now I run a support group for people living with a diagnosis, living with Alzheimer's. And the virtual support group has been going surprisingly well, because we transitioned to virtual support groups or over the phone support groups, because we were doing, of course, a lot of in-person support groups before the pandemic. And the support group that I run, people just love, they really look forward to logging in and connecting with other people who are also living with memory loss. And it's just amazing to see how people love to connect this way. Of course, it's a barrier for some people who, struggle with the technology. So there is that issue. And I just want to shout out to some of our amazing volunteers who run a lot of our other support groups. So I know Leah and Beth from Armbrook Village are on the call, who've been longtime volunteers of the Alzheimer's Association and longtime support group leaders. So we're always looking for more volunteers too. If anyone's interested in running a support group, starting a support group, or doing some of our education programs. So we also offer lots of free education programs, so they're always available. Of course, now virtual. I used to go out and do a lot of education programs at senior centers and libraries, other public spaces, but now they're all available virtually, and we can schedule those if you want to request an education program, you're more than welcome to do so. We provide free virtual education to anyone who's looking for that. And then we also have early stage programming, which is for those living in the early stages of dementia and Alzheimer's, which specifically was meetups before in the community for people with Alzheimer's or dementia. So we would go to Springfield museums or do a meetup for those who are living with memory loss but are still early in the disease but want some opportunity for socializing and meeting up and doing something fun with other people who are going through a similar journey as they are. So we're still doing meetups, but now we've transitioned to doing virtual ones. So we now just have a virtual meetup that's, we have different meetups for different discussion topics. So maybe one on like a food lovers meetup or something like that, meetups for different topics, and also doing like virtual museum tours and stuff like that for now. Okay. And then we also offer care consultations, but I'll go to our next slide here because I know, so Baystate Health is already a dementia care coordination partner, meaning that providers at Baystate can do direct referrals to the Alzheimer's Association, and then we provide an in-depth care consultation with a family or a caregiver, and provide them with a full care plan and follow up with them. So if a patient is diagnosed with Alzheimer's disease, then you can refer them directly, and we'll make that outgoing call to the caregiver or the patient and meet with them for a care. And this is all completely free and available to anyone, and we can provide that care plan and then provide a summary of the care plan back to the provider as well. And what's great about a care consultation is we can just really spend the time explaining to the family really more in-depth detail about educating the family about the disease, what resources are available to them, answering all their questions that they can think of, and just spending a lot of time with them. And so care consultations are available to anyone. It doesn't have to be through their provider. Anyone can call our 24/7 helpline at any time and schedule a care consultation with our professionals and experts. But with the benefit of DCC or dementia care coordination is, some families are not going to be proactive and actually call our 24/7 helpline and make an appointment or make a care consultation. So the way it works with the referral is if a provider refers to us and we make that outgoing call so that it triggers them to actually do the care consultation and not kind of, they won't forget to call us or anything like that. Okay. So that is actually, I think that's it. I'm wrapping up my presentation here. Is there any questions about any of our services, DCC, anything like that?
Yeah, I think there was a question, and I think she might be having trouble with her microphone, so I'm not sure if she can ask, but it was in the chat. Give me 1 second here. Someone was wondering if there were services in the Eastern region for Alzheimer's support groups that you were aware of for caregivers?
Yeah, definitely. So we have, we're a part of it's the Alzheimer's Association Massachusetts New Hampshire chapter. So yes, and the helpline, the 24/7 helpline is a national helpline. So you can call from anywhere all over the country. And what's great about that is if there's family members who we can organize a conference call with all family members from one family. So if there's siblings that are in other states or but you're trying to get the whole family on board to support this one family member with Alzheimer's, but the family can't really agree on a care plan or can't get on the same page, or we just want to educate the whole family, we can arrange a conference call with a whole family or all the siblings or however they want, and to get everyone on one phone call together and with a neutral third party, the Alzheimer's Association, to provide some direction and education and support. And yes, and so yeah, the Boston area has, in Eastern Mass, has tons of support groups available as well.
Great, thank you. We